Hi and Assalamu alaikum. Welcome to Iftikhar Talks. I'm Dr. Iftikhar. I'm Professor of Surgery at Nishta Medical University, Multan in Pakistan, and I have now been practicing surgery for last 34 years. Now, being in Pakistan, I had the opportunity to work in very resource depleted areas and under very austere conditions, really. Therefore, many a times we have been compelled to do a lot of fairly advanced surgery under local anesthesia. So we developed a good routine to do that. Really using the existing knowledge, just reorganizing and arranging it to a good routine. So that we can do major surgeries, minor surgeries under local anesthesia safely, effectively and painlessly for the patient. So I'll share my routine in the form of 10 well-defined tips with you, and I hope you will benefit from it. So let's crack on. The first tip is that if you choose to operate under local anesthesia, we need to keep in mind that this is surgery. So just because of the fact that it is being done under local anesthesia does not mean that we should not be taking all the precautions. So all the safety precautions, sterilization, etc. should be in place. And especially I would like to say, please make sure no matter how small a lesion, you may be taking only a small lipoma out, make sure a patient has got a secure running IV line in place. The second tip is that I almost always, unless there's a contraindication to it, use a little bit of midazolam before even I start infiltrating the anesthesia. Once the patient has been hooked up to the monitor and the first readings tell me that the patient is stable and ready for surgery, I give a very small dose of 2 to 3 milligram to an adult of midazolam IV. This does not put him to sleep, but it acts as an anxiolytic and amnesic agent, and patient does not remember most of the surgical experience at all. The tip number 3 is that please note the medicine that we use, the drug that we use for local anesthesia is lidocaine most of the time, which is known as lignocaine or xylocaine in Pakistan. And the actual generic formula, if you look at the ampule, is lidocaine hydrochloride. So out of this, only the lidocaine is the active drug, and the HCl has to come off for this drug to work. Now, because the body's normal pH is 7.4, that is, it is slightly on the alkaline side. Therefore, for most of the time when lidocaine is infiltrated for a rather alkaline body, it's not difficult for the body to neutralize HCl and take it away, leaving the active lidocaine behind. But if you are operating in an area of abscess or cellulitis, then the area there is acidic, and lidocaine hydrochloride does not work because hydrochloride cannot be separated from it. So local anesthesia is usually not effective for drainages of abscess and in and around the cellulitis area. Tip number 4 is we need to know what is the maximum permissible dose of lidocaine that we can use. Well, if you are using lidocaine alone, the maximum permissible dose is 3 milligram per kilogram body weight. So if you take a 70 kilogram average adult, it is nearly 200 milligrams. But if you add a small amount of adrenaline to it, and mostly these injections come pre-mixed with 1:200,000 concentration of adrenaline in it, which we call lidocaine with adrenaline or xylocaine with adrenaline, then the permissible dose increases from 200 milligram to 400 milligram. This is because due to the addition of adrenaline, which causes vasoconstriction locally, the absorption of drugs becomes very slow. Therefore, its systemic effects are less, and the permissible dose becomes double. Now, in Pakistan, we get 2% solution in 10 ml ampules. So, if you calculate a 2% concentration of xylocaine in 10 ml means 200 milligram. So, one 10 ml ampule is the maximum permissible dose if you are using plain lidocaine, xylocaine or lignocaine. But if you are using xylocaine, lidocaine or lignocaine with adrenaline, then this quantity doubles. and you can use 2 ampules, 10 ml ampules of 2% solution of xylocaine with adrenaline. So this is the maximum permissible dose. Now, the addition of adrenaline not only increases the dose, actually doubles the dose, permissible dose, it has other advantages as well because of its vasoconstriction effect. The first and the foremost is that the area of operation is much less bloody. Because of the vasoconstriction, the bleeding is much less. Number 2, again because of vasoconstriction, because the drug cannot readily escape into the systemic circulation, it sort of stays and plays, so time of anesthesia is prolonged, effective time of anesthesia. And then number 3 is again because of vasoconstriction, because the drug cannot readily go into the systemic circulation, so risk of systemic effects, systemic side effects are rather less. So therefore, I always recommend that unless there is a reason, you should always use lidocaine, xylocaine or lignocaine with adrenaline and not plain. Now there are only 5 areas where plain lidocaine should be used and lidocaine with adrenaline should not be used, and those 5 areas are base of the fingers, similarly base of the toes, like for ingrowing toenail, etc. And third is the base of the penis, like we use in for circumcision, and ear lobule and ala of the nose, like we use in piercing for rings, etc., etc. These are the only 5 sites where you should not use lidocaine or xylocaine with adrenaline, rather should use the plain solution, right? Because sometimes xylocaine causes intense prolonged vasoconstriction. These being end arteries may result in necrosis of finger, toe or whatever, right? So other than that, please always use lidocaine with adrenaline. It has got lot of advantages. Tip number 5 is that now if you are using plain lidocaine, as I mentioned, and you are using 2% solution, then you have got only 10 ml. 10 ml is a very small volume. For example, if you have to take a lipoma of 5 by 5 centimeter out from the left shoulder, 10 ml just vanishes. And you are surprised you have not been able to infiltrate even the half of the skin required. And even if you are using lidocaine with adrenaline, you have got only 2 ampules, that is 20 ml. Even that is not enough. Therefore, I almost never use 2% solution. I always dilute it 4 times. That is, in a 20 ml syringe, I'll take 5 ml of 2% solution of lidocaine with adrenaline and add 15 ml of water to make it 20 ml. That gives me a 0.5% concentration. And I have found that there is not much difference of efficacy between 0.5 and 2% as far as the local anesthesia effect is concerned. Actually, because I am using a much diluted solution, the risk of systemic side effect is much less. So I always dilute it 4 times. I always use a 0.5% solution, which gives me in a normal adult 80 ml of volume to play with, which is enough for most of the procedures. But if you are doing a procedure where you use more, where you need more than 80 ml to infiltrate, for example, you are doing a hair transplant and you need to sort of infiltrate the whole scalp, then even 80 ml is less, then you can even dilute it further from 0.5% to 0.25% or even 0.125%. Right, so if you are using 2% solution of lidocaine with adrenaline, you have got 20 ml. If you are using 0.5%, you have got 80 ml. If you are using 0.25%, you have got 160 ml. And if you are using a 0.125% concentration, you have got a 320 ml solution, which is a lot of solution really to be for infiltration. The only thing is that if you are using a higher dilution, like you are using 0.25 or 0.125% solution, you need to give a little bit more time. You need about say 25 to 30 minutes after infiltration before the patient is ready for incision, because the drug is in much less concentration, takes longer time to work. The 6th tip is that because we infiltrate a lot of volume of very dilute xylocaine or lidocaine, therefore that volume causes sort of a local edema and obscures the landmarks. Therefore, I always advise that before you start infiltration, you need to mark on the skin all the important landmarks for that surgery. Not only that, with that edema, all the skin creases also disappear. So mark the skin incision as well. So mark the skin incision and all the important landmark before you start infiltrating. Right. The seventh tip is that you need to infiltrate not only around the lesion that you are going to operate, you need to infiltrate underneath it as well. Otherwise, the patient will feel pain. For example, you have got a 5 into 5 centimeter lipoma on the left shoulder. Not only around, you need to go underneath the lipoma as well, full length. Sometimes our ordinary 21G green needle that comes with 10 or 20 ml syringe is not long enough. In that case, consider using a 20 or 21G LP needle so that you can go all the way around and underneath the lipoma so that when you are operating, patient is completely pain-free. In addition to that, despite all our efforts, sometimes what happens that when you are operating, patient has got a small patch of area which has not been adequately infiltrated despite our best effort, and patient feels pain whenever you are working there. So keep a 20 ml syringe containing that diluted lidocaine solution on the sterile trolley, so that if need be, you can top up during the operation a little bit here, a little bit there, that local anesthesia solution that you have got on that trolley. Tip number 8 is that please remember that lidocaine or xylocaine is not magic. It's a drug. It takes time, and the more dilute solution is, the more time it requires. Many a time surgeons, what they do is they have already sort of painted the skin and draped the area and put the gowns and gloves on, and they have got now a syringe of local anesthesia in their hand. They infiltrate and straight away sort of try to put the knife to the skin. Now this is not going to work. The patient will have a lot of pain, patient will be jumping up and down, and you will have a very unsettled sort of operation. Please always, it's our routine that we infiltrate before we drape the patient. So infiltrate and then go scrub yourself and don the gloves and gowns and everything, and somebody prepares the patient's skin for you and puts drapes on. This takes good 15-20 minutes, and that is enough for drug to work. Now if you infiltrate before you drape, then by the time you come for surgery, the patient is ready for operation, right? The ninth thing is that everything I told you before, we have put it in the right order, right? To ensure that I have not missed anything and I have not done anything in the wrong order. Do things in the right order and things will go right. And the right order is that first of all, as the patient is moved into the operating room and put on the operating table, the first thing that should happen is that you need to connect the patient to a monitor. This is operation, and patient should be monitored throughout, and he should have a running good secure IV line. Number 2, now mark the skin, mark all the landmarks and mark the incision, right? Number 3, give patient a little bit of midazolam 2 to 3 milligram in an adult, so that it acts as an anxiolytic and an amnesic agent. Now infiltrate with a dilute solution, probably 0.5% or maybe even 0.25% or even 0.125, depending how much volume you need. Now infiltrate with local anesthesia. And fifth thing is that after you have infiltrated, now somebody should prepare the skin and drape the patient, and you need to go and prepare yourself, wash your hands, drape, put gowns on and gloves on. And by the time it takes you 5, 10, 18 minutes or whatever, you will come, the patient would be ready for surgery, and only then you operate. So infiltrate and then drape and then operate. Another thing that I would like to mention, to make this experience very painless, make sure that the first injection of the infiltrating xylocaine that you make, that you should use a very fine needle. We use a 27 or 28G insulin needle, right? We raise a bleb. Once that bleb is raised, it immediately is anesthetized, and then our needle goes through the bleb, right? So patient only feels the sting of the first insulin needle and nothing after that. And after that, we ensure that if we have to insert the needle from another place, that place should be the one which has already been anesthetized by the previous syringe. So only one needle stick, and that too a very fine needle. And if you are using the local anesthesia to stitch a wound, please don't go through the intact skin at all. Go through the cut, because if you are stitching a wound, the skin is already broken. Go through the broken skin, it is almost painless. right? Now we go to the last tip, which is tip number 10, that despite our best efforts, despite our best precaution, sometimes what happens is that patient does show sign of toxicity, and we need to know the signs of toxicity and how to treat it. Now the lidocaines toxicity, the most common are those that are the manifestation on the CNS, which is confusion, agitation, and sometimes seizures. Agitation and seizures are actually the most traumatic and alarming thing and take surgeons completely off the guard. Now, if your patient has got a lot of agitation and ultimately goes into seizure, you need to know that this needs intravenous midazolam or diazepam. See again, you need a secure, functioning, running IV line to combat the side effect. In addition to CNS effects, patient can manifest CVS effect, though they are not very common. That is drop of blood pressure, unless you have infiltrated and used a lot of drug, which you should not, and sometimes very rarely arrhythmias. There are other miscellaneous side effects as well, which include allergy, nausea, vomiting, and tinnitus. Right. Well, that completes our schema of using local anesthesia safely, effectively, and painlessly for the patient for whatever you want to do surgically to the patient. I hope you like it. If you like this video, right, please mark it as like on your phone or computer as well. Subscribe our channel, Professor Dr. Iftikhar Talks, and don't forget to press the bell icon. We upload an medical academic video like this almost every week. So please look after yourself and everybody around you, and especially your patients, and may Allah be with us all. Thank you very much for watching the video. Assalamu alaikum wa rahmatullahi wa barakatuhu.